So good morning. My name is Karen Dees. I am the marketing manager for Patient Concierge Services. We also have a private Facebook group called STAR for surgical transformation and aesthetic rejuvenation. And we do lots of interviews with doctors and plastic surgeons to give you guys as much information as possible so you can make an informed choice about your aesthetics and your surgery. And today we have Dr. Risma.
Hi, Karen. Hi.
I won't give the viewers information about you. I'll let you do it for us. So tell us who you are and a little bit about yourself.
Thank you so much, Karen. And thank you for PCS and STAR Facebook page for inviting me for this interview. So my name is Dr. Risma. I'm dermatologist. Currently, I have our own clinic. It's called Keina at Renon dan Pasar. So Keina is near Sanur. If anyone knows Sanur. Yeah, so that's for now. Let's talk about it and let's know me more, yeah?
Yeah,
okay,
amazing.
Yeah.
Just before we jump into the next question, I know you're a dermatologist and you can also do some cosmetic surgery as well. And I think you can do a few different things, but today we just want to focus on blepharoplasty.
Yes, of course. So as a dermatologist, I'm not only focusing on the disease, but also an aesthetic part. So actually my degree is dermatologist, venereologist, and esthetician. So as a dermatologist, I'm involved of all kind of diseases and also screening for skin cancer, like doing dermoscopy and doing excision. But the skin surgery that I'm allowed to do is certain part, is only in dermatologist field. But I'm allowed to do blepharoplasty, absolutely, and we will talk about it now.
In more detail.
Yeah,
amazing.
more detail, yeah.
So after years of being a dermatologist, I'm assuming it took a long time to become qualified. Is it like 7 or 8 years of studying?
So after we graduate as GP, we have to study like 3.5 under 4 years to qualify as a dermatologist and venereologist and esthetician. So it's quite a journey.
It's quite a journey.
Yeah.
So you're like an expert in the biggest organ that we have, which is skin. So you probably have an advantage over some plastic surgeons because you understand skin at a really deep detail. So what inspired you to start doing blepharoplasty?
So actually, blepharoplasty in our field, in our study as dermatologists, blepharoplasty already been introduced by us, and we're doing certain practice and learn about blepharoplasty. But after graduation, we can choose, what field that we're really interested about, and going forward to it more and more, right? Why blepharoplasty? Because everything said that when you meet someone, eyes is the most important thing.
The window to the soul.
Yes, right. The window to the soul. And like, that's the first impression. That's one thing. And the second thing is, it's so different, before and after blepharoplasty. With the really simple surgery, minor skin surgery in the eyelid area, and it's already making much more difference to the patient. Yeah, and also it's not only about the cosmetic. Sometimes it's also can distraction the eye.
That can improve the vision.
Yes, the vision, So sometimes it's already distract the vision, and we help them to make a clear vision again. So,
I know what you mean when I see before and after images of people who've had blepharoplasty. It's just such a transformation. It makes them look more awake, more younger, like fresher, more alert.
Yeah.
And I think for something that's not hugely expensive, it's the best. Well, I think Australians say bang for your buck.
Oh, okay. I just know that.
What would you say the difference is between having blepharoplasty done by yourself, a dermatologist, who's allowed to do blepharoplasty, versus somebody who's just a plastic surgeon? Or, their main focus is plastic surgery?
Yeah. Actually, Karen, the one thing that I want to clear up is doctor that allowed to do blepharoplasty is dermatologist ophthalmologist.
Okay.
Yeah, and plastic surgery.
Okay, so general practitioners cannot?
I'm not sure.
Okay.
But ophthalmologists also can do blepharoplasty, yeah. But the difference between dermatologist and ophthalmologist and plastic surgery is basically in the muscle area.
Oh, okay.
Yeah. So if you heard about ptosis, have you heard about like lazy eyes?
Oh, okay. Yes,
yes. So it's not about the sagging of the skin, but also involvement of the muscle that make it lazy eye. So sometimes we need to cut a little bit of muscle and do manipulation to the muscle, like grafting the muscle and anything else. That's I'm not allowed to. Okay. So I have to revert to ophthalmologist or the plastic surgeon. Yeah. So my field will be on the skin area because of the sagging. Okay. And also in the lower sagging. Okay. And fat deposition.
Oh, okay. So fat deposition, does that mean fat removal or fat relocation?
No, only fat removal.
Only fat removal.
Yeah.
Okay.
So actually, I'm doing a lot of fat removal down for lower blepharoplasty, as long as I'm not touching the muscle, you know, because muscle is really tricky situation.
Well, it's attached to ligaments and stuff, I think. Yeah,
right. So for the fat reposition is also involved muscle, so I'm not touching that area.
So you can remove the fat and remove the skin?
Yes.
Okay.
Yes.
So that's your area of expertise?
Yes.
Okay.
Yes.
So if anybody that's watching is really curious about getting this procedure done and quite naturally nervous or unsure, have you got anything that you could say to them?
Yeah. So first thing first is, this is minor surgery.
Okay, minor.
So, but I totally understand why they're afraid or have anxiety about it, because in the eyes area, you know, and they always ask me if it will affect their vision or their eyeballs, but I want to make clear that I'm only doing things in skin area.
Okay, so it's like surface level.
Yes, really surface level. And I will do the 2 Mason anesthesia.
That's local?
Yes, local, but make your eyelid area bulging, so I will stay away from the inside. I want to make sure that you are comfortable.
Can you give them a Valium or like something to relax them?
Yeah.
You can? Okay, good.
Yeah. But I need to check. So before the procedures, we will do the teleconsultation.
Sure.
So I will know the expectation of the patient. Is the patient have any anxiety and any diseases that I have to prepare of? That's the first thing I have to do and make sure before we jump into the booking process and the procedure process.
Yes.
A lot of patients have that anxiety. But so many patients, they already done it. They said that, oh, it's not that scary. You know. And and the recovery also, oh, it's not that bad. And some of my patients even work after the procedures. You know. Because it's minor surgery.
Quite minor.
It's quite minor. And for the fat removal, for the lower part, we also can do, we call it transconjunctival blepharoplasty. So it's from the inside. Oh. So we don't need any stitches. Okay. But the one that capable of this kind of surgery is only that has the elasticity is still good. Okay. It's not quite sagging. The elasticity is still good. So we just remove the fat and no stitches, only a couple bruises, but we'll go like 7 or 14 days. Wow. So let me just check I've got that right in my head. If somebody's got quite strong collagen elasticity and they want lower blepharoplasty, but it's more about just the bulging
aging from the fat.
Yeah.
You can go inside and remove it from inside, so it's a scarless procedure.
Yes.
Wow.
That's a scarless procedure.
That's amazing.
That's amazing.
Yeah.
And after 1 month, we can do radio frequency.
Okay.
To help tightening. So it is a spoiler, but we will speak about it later. But we will launching Oligio for this July. It's a monopolar radio frequency treatment.
Wow, is it a machine?
Yes.
Yeah.
It's a device machine. It's like Thermage, if anyone know about Thermage, But this is the evolution. Minimum pain, no need anesthesia, good result. Stimulate the collagen, and you only need to do it every 6 or 12 months.
Is it similar to HIFU?
I will talk about it later, another time, So it's HIFU is ultrasound. This one is radio frequency. Safer than HIFU.
Yes.
And you will not get
any fat dissolving.
Yes. That's the key.
Yes. One of the things I love about you, Dr. Risma, is you always talk about safety. You're very, very hot on the safeties.
You also know that it's so hard to get device in Keina, right?
Yes.
Because I'm so picky.
Yeah.
I'm really want to give the best to the patient. No downtime. The most effective one. The most worth the money and the time, So finally, I find some device that I hope can help the patient.
Amazing.
Yeah.
Fantastic. Okay, so down to crunch time. Everybody's wondering, how much is this going to cost me? And from my understanding, everybody has a bespoke price depending on the quality of their skin and how complex the procedure is.
Yes.
So can you give us a guideline of the minimum to the maximum?
It depends on, do you want to do it lower only, upper only, with local anesthesia only, or with general anesthesia? So for someone that really want to do it but still have anxiety, we can do it in hospital with anesthesiologist with proper thing, and you can stay at the hospital for 1 night.
So the price range depends on a clinic, the hospital, and obviously case by case depending on how complex your blepharoplasty is. So before we wrap up, is there anything else that you'd like to add to end this interview?
Yeah, so for the wrap up, I just wanted to say that aesthetic part is a really interesting journey, right? We do want to age gracefully.
Gracefully. I love that word.
Yeah.
Sometimes I have resistance.
Right. We don't want to age completely no.
No,
but
naturally,
yes. But we cannot avoid that.
No.
But we can age gracefully.
Yes.
But still, as a doctor, has a responsibility to make sure everything is going okay, safe, and you got the result that you want and you deserve. But remember, any medical procedure has their own side effect and complication.
Yes.
And also, one thing that we never as a doctor can predict is allergic.
Allergy.
Yeah.
Okay.
So, allergic is an unexpected thing in medical procedures because, sometimes it just happen, So, I will explain to you all about the blepharoplasty with the consultation. So, we both can have the same understanding.
Yeah.
Then we can proceed. I will take care of you.
And you take care of you.
And
the lifestyle is so important, isn't it? Like stop smoking, reduce alcohol.
That will be really helpful.
Yes.
I will help you for the education, but still, Karen is right. I will take care of you. I will give all the information that you need. I will guide you through the healing process, but I need you also to take care of you. That's a good point,
That was
Karen.
a good ending.
Thank you so much.
Thank you so much for watching, everybody. Post any questions below.
Bye.
Thank
See you again next time.